blinded me with science. She blinded me
Hello and welcome. So today we are going to talk about addiction and dual diagnosis and what exactly is a dual diagnosis, how can it complicate your therapy for mental health, etc. So mental health is a really vast issue. There are a lot of different angles to it. Last week we were lucky enough to have a member from Take 6 and his wife talk about pediatric mental health and what occurred with them and their sort of journey through this with their child. And this week we're going to delve into addiction. And specifically, we're going to deal with addiction and how it can complicate things. So first, let me start off with a conversation around addiction, because there are a lot of different things you can become addicted to. If you really want to know all the strange things you can be addicted to, there's a show called I'm Addicted to Strange Things. And that show actually goes over all the various things you can become addicted to. But I'm going to go through some of the main things that we see in our community and that impact our family and our loved ones. So the first one is the most obvious one, which is drug addiction. Right. So drug addiction actually leads to overdose deaths. And we have about 108,000 people a year in America that die from drug overdoses. And about 3/4 of those drug overdoses are opioids. And, I often have people say to me, what is an opioid? So I'm going to go over what is an opioid. So an opioid is heroin. An opioid is morphine. You can also have synthetic opioids. And by synthetic, that means it's man-made. It can be made in a kitchen or a factory. It's not naturally occurring in the environment. It's actually man-made. So those types of opioids are fentanyl, which people have heard about. Tramadol. We have a lot of family members that are on tramadol, and they do not know that that is an opioid. So tramadol is an opioid. Methadone is an opioid. Carfentanil is an opioid. And you will hear more about carfentanil because carfentanil is sort of a more potent form of fentanyl. So if you want to know how potent carfentanil is used in veterinary medicine when you want to put down, like, let's say, an elephant. Okay, that's what carfentanil is, and it's sort of entering into the streets. Some people call it fentanyl, but it's carfentanil. When you look at things that are synthetic, whether or not it's fentanyl, carfentanil, these are 50 to 100 times more potent than morphine. And they have a higher risk of overdose. We do use fentanyl in the emergency department for therapeutic use at very small doses. When we are doing things like dealing with hip fractures or shoulder dislocations or hip dislocations, etc. So that's kind of what an opioid is. And what happens with opioid addiction is when people try to stop using, or when they stop using because, let's say, they get incarcerated or they don't have any money anymore, they kind of get excessive drowsiness, and they call them the druggies on the street, kind of dozing. They get nausea, vomiting, diarrhea, abdominal cramping, muscle pains, an excessive craving actually to use the drug again. And the treatment for opioid addiction is there's a medication therapy. It can be either methadone or Suboxone, or also called buprenorphine, naltrexone. These are all medications that are prescribed to actually kind of get someone through the withdrawal process. And once they're no longer having the excessive cravings and the abdominal pains and the diarrhea, then they can really focus on cognitive behavioral therapy, support groups, and actually really looking at, what was going on in their lives that led them down this path and how to actually recover from it. A lot of times with opioid addiction, you hear a lot about people talking about Narcan, and I want to just talk. The most publicly known case of Narcan is when Prince had to emergently land his plane. I don't remember exactly where he landed it, and he was administered Narcan. That's probably the most publicly known case of it that we've had in our recent history. So Narcan is very interesting in that it's considered to be a life-saving drug. It's been around for a very long time. someone can be in the process of overdosing, and it can basically take all the opioids off the opioid receptor, and literally the person will literally come back to life. Like literally they'll be out and unconscious, and we give them the Narcan and they literally wake up. Usually they wake up and they're mad at us and they're cursing at us because we have messed up their high, right? And so although we saved their life, we don't necessarily get a thank you when that happens. But the other thing to know about Narcan is that Narcan can really make patients more likely to overdose. So I don't know if everyone remembers, but when Prince landed his plane, about 30 days later, 60 days later, he was dead. And so one of the things about Narcan is it's really important if you use Narcan or if you have a family member who has had Narcan used, that they immediately get into some sort of rehab and some sort of treatment and get on some sort of medication-assisted therapy. Now, there are other drug addictions: cocaine, ecstasy, ketamine. We've heard a lot about ketamine. We've heard about ketamine related to Matthew Perry from Friends, who died of a ketamine overdose. We're hearing about ketamine today related to Elon Musk. There's marijuana, K1, LSD, Met. I mean, there's just all sorts of things, but opioid is probably the biggest category as far as overdose and death. Now, the other big addiction that we're seeing, and we're seeing this more and more and more, particularly now that this is on our phones, and this is gambling addiction. Gambling addiction affects about 1% of the population, has severe gambling addiction problems. One of the things about gambling addiction is it has a very, very high suicide rate. And so if you have a family member struggling with this, it would be really important to actually get a handle on this. There is a preoccupation with gambling. They are always gambling on everything. They want to increase their bets. There's lying and hiding about gambling. There's usually also jeopardizing relationships or jeopardizing their finances. There is a GAMBAN, GAMBAN, which is an app that will block all gambling sites from your phone if you have someone that's struggling with this. And then there's Gamblers Anonymous and other cognitive behavioral therapy. Then the other category, big category of addiction that I wanted to really talk about, there's two more: sex addiction and porn addiction. So, we've probably seen this more, porn addiction. Kirk Franklin talked about it, that he was addicted to porn starting at the age of 8 years old. Then there's also sex addiction. And what these kind of look like is compulsive thoughts around sex or pornography and inability to control their behavior. And the main thing is that oftentimes these patients will have negative consequences. So they will have negative consequences like maybe an arrest, or maybe they'll be involved in a sting accidentally, or maybe they'll be arrested in some sort of situation with a prostitute, but their behavior continues despite those negative consequences. And so that's kind of like where we see folks with sex addiction and porn addiction. I've got a lot of questions around this related to what we're hearing about the P. Diddy trial. And as I tell everybody, I have never met P. Diddy. I have never examined P. Diddy, but certainly there is something there that requires investigation. The next type of addiction is food addiction. And this actually impacts 70 million people in the United States. This is a big one. And this is, eating even though you're full, having very, very intense cravings. Like I have to have some ice cream, right? And going out for that. Also, a big part of food addiction is feeling guilty after eating. So maybe you eat the whole pint of ice cream and then you feel really guilty. Or I know one of my things when I was younger was, I don't know what it was. I used to eat the whole box of vanilla wafers. Vanilla wafers was like my thing, right? And it can be very, very difficult to actually get over this. And some people to deal with this actually go to Overeaters Anonymous and all of that sort of stuff. And it, I think whatever you're dealing with is important to get a support group around it. So what I want to talk about today is how do addictions and mental health, I want to talk a little bit about that intersection, right? So, we consider it to be someone having a dual diagnosis when they have a mental health disorder and on top of that, they're using some sort of substance. Right. So it could be that I'm depressed, so therefore I use cocaine. I have thoughts in my head, so therefore I use marijuana. Right. So what happens sometimes is the use of these medications can be used instead of going to the doctor and getting prescription medication, or it can be used in addition to going to the doctors and getting prescription medication. And how it sort of complicates things is one is a lot of times patients will not tell us this, right? So on almost all patients that come through the emergency department for any sort of mental health treatment, we always do a urine drug screen all the time. Like I don't even really ask anybody anymore if they use drugs or not. I just do the urine drug screen and I just let the urine drug screen tell me, because what they tell me is like, I don't know, I just like Charlie Brown's teacher, womp, 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 like I don't really need to hear it, right? So I just get the urine drug screen, right? And then once I get the urine drug screen, then I have the conversation with them. Okay, I know that you are using whatever it is, marijuana, cocaine. Tell me a little bit about your use pattern. And that will tell me whether or not they actually have a dual diagnosis. It can be, it's a little bit easier with drugs that are illegal, like cocaine. It's a little bit harder with things like marijuana or alcohol, because are they using it and using it legally and appropriately, or do they actually have an addiction, right? But in any way, shape, or form, it can actually complicate a person's actual mental health treatment, because are there symptoms related to what they're using in the street, or are there symptoms related to their underlying disease? So, when someone has a dual diagnosis, it's really important to really actually treat both disorders simultaneously. And it's really important that their recovery, that you actually prevent relapse of their addiction and use disorder, as well as prevent relapse of their mental health disorder. This all can be very difficult and kind of is a lot to really sort out. The symptoms can be very much overlapping. I wanted to actually bring on, we have today a special guest, and this guest dealt with some of these issues with her daughter. And I'm going to actually bring her into the conversation. So let's actually introduce our guest, and I want to thank Andrea for joining us. Andrea is a parent of a child who actually suffered with mental health problems and ultimately passed in December of 2017. And I want to thank Andrea for coming on this show and actually sharing her story, and so that it can help others, because this is really, really important. We need to understand what's actually happening out there in the community and what to do when we have family and friends in our network that actually need to get help. So Andrea, welcome. How are you?
I am well, Dr. V. Thank you so much for having me.
Great, great. So tell me a little bit about what happened with your daughter. You can start wherever you'd like.
Goodness, we love Christmas, and Christmas is the time when I lost my daughter, Dr. V, and it was December 26, 2017, and she was 26 years old. And it was very interesting how we lost her life when it comes to mental health. And, it just encouraged by this conversation that you're having on your show today, because many of us as parents, we feel like we're by ourselves, and we don't know where to start having conversations with not just friends, but our family about what's going on in our lives. And then we ended up losing my daughter to challenges that she was facing inside of her health and her mental health.
So in December of 2017, when this occurred, tell me a little bit about kind of what happened before she lost her life? You know, a lot of times people, you know, a lot of times people talk about the stigma of healthcare, but was there reaching out for help? What was going on with her? Tell me a little bit about what led up to it.
So December 2017, we're going to go back. You know, you look at those television shows, they'll say 3 months earlier, right?
Right.
And so
right.
At this point, let's go back 3 months. And this would be right when school was starting. So end of August and September of 2017, my daughter was having severe manic attacks.
Okay. Now, wait a second. Now, wait. Let's describe when you say a manic attack, just so that everybody understands tell me the sort of things that you were seeing that made a manic attack, so people understand what that is.
When they are in a manic attack, they can't control their behavior. Everything is urgent. None of it makes sense. They're seeing things. Someone may be following them. They cannot control this hyper behavior. And we'll get into the early part of her life. We saw that early on when they had ADHD, right?
Okay.
And so now they're adults, and it's now coming into this manic or mania.
Okay.
When none of it makes sense to us.
Right.
Inside of why they can't reason.
Right. So everything has a sense of urgency, right?
Everything is a sense of urgency. Everyone is there to come against them. No one's there to help them. Their reasoning doesn't make sense to us who aren't experiencing what they're in that moment.
Right. Right.
And so what shows up is no one's there to help me, so I'm crazed. And we see it as they're being crazed. Mm-hmm. Mm-hmm. Or just what do we say? Hey, just calm down, settle down. It's kind of one of those things. That's the worst thing to say to somebody is to calm down, right?
Right.
Settle yourself.
Right.
But
so it's a very agitated state, right?
Agitated.
Right.
Very agitated.
Right. And some people in this agitated state, in a manic agitated state, will go out and buy a car. Some people will make these crazy purchases. Some people start cleaning the house nonstop. Some people start messing up the house nonstop. Like it's very, very agitated, and whatever they want has to be done now. So I'm glad we kind of described that for folks. So you saw that in August or September.
Absolutely. But even, you know what else it shows up, especially for mothers who have children? They begin to hoard their children. Mm-hmm. They begin to protect these children as if there's going to be additional harm to them. Okay?
Right.
So it can show up as that as well.
And your daughter had children.
And she had children.
Okay.
And 3 lovely boys.
Okay.
And what was happening is she knew when she would go in and out, right? Mm-hmm. You'd have this ebb and flow in and out of her, of this mania. Okay. Now, mind you, in 2017, at least 3 years prior to that, Dr. V, she was diagnosed with schizoaffective, okay?
Okay.
And she had been prescribed medication, drugs, and we can get into that. And remember, I tell you, I'm not a doctor and I don't play one on TV, but I know one of these don't go with the other.
Right.
And so what happened is now we're 3 years after she's been diagnosed with schizoaffective, and she is now realizing that, hey, I can't control what's happening in my head. I'm scared that I might do something with my children. Okay. And to my children. And as parents, as her mother, what do you do with that? How do you help that when they're in and out? Right. And so what happened at this point, Courtney continued to call the police. She would call the police, Dr. V, because she is asking to be admitted. Okay. And so this went on, Dr. V, on a recurring basis every week for almost 2 months.
For every week for almost 2 months, she would call the police to try to get help. To try to get help. Right.
And
so wait a second.
So the ambulance out.
And the ambulance would come out. So yeah, tell me what exactly, because I think this is really important, because people think that folks have a stigma and that they don't want help. But my experience of folks with mental health disorders is actually completely opposite. I actually find that they do reach out for help. So tell
They
me,
do cry out.
yes. So when she would call the police and they came out to the house and the ambulance came out to the house, and describe to me, do you live near her, or are you in a different state?
I'm in a different state,
Okay.
and I have such amazing sisters and family, and they would be there if I'm not able to get up there.
Gotcha.
But someone would be there. They would get there in time sometimes.
Okay.
When the ambulance is there. So this is what's happening. When we're dealing with law enforcement, we're dealing with paramedics, and they all show up at the house, right?
Right.
And, you talked about it last week on the show that, law enforcement are not trained for mental health calls.
No.
That is not what they're there to do.
Right.
They are there to keep the peace, right?
Mm-hmm.
And try and cause no harm to anyone that's there.
Mm-hmm.
So when this is happening, the best thing for them to do is to call paramedic.
Right.
And so what happened is, and I'll never forget this, I'm watching it as I'm telling you, and I'm driving up, and they're literally taking her on the stretcher onto the ambulance. And she says, "Mama, I just need some help. I just hope that they just keep me." So to your point, they call out for help. Are we listening?
Right. Right.
Before it goes too far. They want help. Yeah, go ahead.
So what I would like to do is, if you could share with us a little bit about what occurred when she got to the emergency department, right? Because I think that's a piece that people really don't know, exactly.
Yeah.
So she did call once a week, and usually they do send them to the emergency department, which is where I work, right? And so let's talk about what happened once she actually got to the emergency department, so that people can actually understand what occurs in this whole process. All right. So Andrea, you were saying that about four months or so before your daughter passed, that she called out regularly for help, and that about once a week she called 911 to get help, and that you remember her being on the gurney, being loaded up in the ambulance, stating to you that she really wanted to get help. So share with us and walk us through what occurred after that.
Dr. V, we know it as parents that there's something going on. And when she's on this gurney, she's going to the hospital, she is pleading for help. And when we get there, they are giving her, an IV for fluids, or they've given her another dose of her prescribed medication to try and control it. But what was interesting, I'll never forget this conversation that I had with the law enforcement, and he'd been there a couple of times, and I'd seen him there before. And I said, well, how can we get her admitted? Will you guys keep her? She's asking to be kept, not an involuntary, Dr. V.
Mm-hmm.
This is someone voluntarily saying, please keep me, help me get better. I don't know what's going to happen to me.
Right.
And the police tell me, hey, we've seen this before. This won't last much longer. And I'll never forget that man saying that to me.
So he was basically predicting her death.
Yeah, absolutely. Do I think he meant it to be ugly towards me or insensitive? I'm not going to go into that. Right. However, when they are called to our homes, and we are pleading with help, we're not equipped to handle it with our children. We're trying to get them on the medication.
Right.
We're trying to get them the counseling. We're exhausted because we're not experiencing what they're experiencing.
Right.
But when they are calling out for help, I plead with our parents and our family and our friends to do what we can to try and help them.
Right.
And these are things that they can't control.
So why do you think that she did not get the inpatient help? So if she's voluntarily willing to go into an inpatient mental health, she was trying for 4 months before she passed. Do you think it was discrimination? Do you think it was because of maybe insurance issues? Do you think that people weren't taking it seriously? What do you think was the reason why all of these cries for help were not listen to?
First, I will say insurance, because she's not insured for that type of coverage, right?
Okay.
And who's going to foot that bill, Dr. V? Dr. V, as an adult person, right?
Right. So she was
And-
uninsured, or was she on an insurance that
She would've-
insurance that gave you problems?
She would have been uninsured.
Okay. All
She
right.
would have been uninsured.
Okay.
Underinsured. How about that? Underinsured.
Okay.
So there wasn't insurance coverage for that type of inpatient care.
Okay.
And so what they would do is they would stabilize her, because oftentimes our loved ones are going to show. My daughter showed in many points of her day that she could manage. She's in her right frame of mind, right? So if I'm showing that in the hospital, and again, you're in the emergency room, Dr. V, so you answer that. They can say, hey, they look like they should be okay to go home. There may not be a room available. There's no insurance to take care of this. Put her back on her meds and send her back home.
So
Right?
yeah. So let me just go over a little bit how that process works. And I've worked in several different states, right? And so, we do actually first do a medical clearance, right? We do labs, and we also do a urine drug screen to see whether or not there are any drugs in anyone's system, and to see whether or not there's any medical reason for the particular symptoms that they're having, right? So once someone is medically cleared, and if they decide that they want to actually go into a voluntary commitment, we have them sign paperwork, and then they do a bed search, right? And so we do have people, for whatever reason, and sometimes it's because they're a dual diagnosis patient, or sometimes it's because of insurance issues, where there's no bed available, right? And then the decision is made, well, can we move up their appointments, their outpatient appointments? Can we adjust, can they see a psychiatrist in the emergency department? And can we adjust their medications a little bit? And are they safe enough to go home? Do you know, did she ever, did they even do, I don't know what state, I don't know what state your daughter was in, but did they even get as far as doing a bed search?
I don't believe that they did. And,
Okay.
And so even hearing your protocols, and again, we don't know this as the patient, as the family. It's good to hear this more on your side of what you're doing, right? What the hospital is doing and the care. What we see is, why can't you help them? That's all.
Right.
That's it.
Right.
And you mean to tell me that they're asking you for help, and all you're telling me is, I'm going to send them home on their meds? Well, we know what happens with the meds. For my daughter, who's a young mother, and she had her own business, Dr. V. She was an amazing girl, and she couldn't function on the medicines. She's she's on the olazapine, and she's on these other medications, and she can't function. She says, Mom, I can't take care of my kids. It's going to make me stay in the bed all day.
Right.
And then what it does is that if they already have some precursors to, or, of some autoimmune disease, it might be Crohn's. She was suffering from Crohn's as well. She was dealing with that sciatic nerve as well. So you're complicating things, Dr. V, with, hey, I'm trying to take care of my kids. I don't physically feel good, and I'm dealing with the schizoactive, and I got to take medication. I'm overwhelmed just explaining it.
Right. Yes. Yes.
So what do you do with that? And so when she was taken to the hospital, every single time, Dr. V, they would release her.
Every single time they would release her.
Every single time they would release her.
Can you share with me what state was she in? I'm just kind of curious.
She was in Oklahoma.
She was in Oklahoma. Okay. Okay. All right. It is so it is absolutely more difficult to get care in a red state. I hate to say that, but it's true.
The evidence is there.
Yeah.
Even with me making a calculated I put a team together, right? I put her landlord together. I put a hospital together. I went and found her a room to put her in. I went and got a psychiatrist to come meet me at the house. And so I said, this is what we're going to do. If she calls again, okay, we're going to, if she calls again, everybody, we need to have a team in place to get her out the house, to get her admitted.
So a couple of things. Do I have a caller on line too? Okay, yeah. I'm sorry. I've got a. Let's take this call. We've got a caller on line 2. Brother Brown.
Sister Andrea, I'm so sorry for your loss. I can feel the pain in your voice, but you are a trooper. You are making it through. And Dr. V, thank you for having this type of platform. But my question is, when one is admitted to a hospital, and if they think they want to harm themselves or somebody else, they automatically are on a suicide type of a watch, and they automatically supposed to keep them at least 24, maybe 48 hours.
Yeah, so you're talking about a 72-hour hold. Yes, associated
which
with
is mandatory.
Right. So a couple of things. So when she called 911, Andrea, was she attempting to hurt herself, or was she having problems with her activity of daily living?
Activity of daily living. So he has a good point.
Yes.
So they're going to ask the questions. Do you feel like you're going to harm yourself? Do you feel like you're going to harm others? Should they say no,
right,
and that, then they've checked that off. They're not going to harm anyone. They don't feel like they're going. That spirit, that activity that's going on in their head may not be present to say, yeah, I'm going to do this, or yes, I'm going to do this to someone else. So they answer no.
Right.
Go ahead.
Yeah. So I was going to say, so there's a lot of people who have problems with activity of daily living. They're not taking care of themselves. Maybe they're not paying their bills. Maybe they're not taking a shower. Maybe they're not combing their hair. Maybe they're not going to work. And their mental health disorder does not actually present itself as I want to kill myself, or I want to hurt or kill someone else. It could just present with I can't take care of myself, right? So we see that with the homeless population, right? You can't go around and lock up the homeless people for 72 hours because they're not suicidal. They're just not able to actually create a stable home, go to work, and do those sorts of things for themselves. So Brother Brown X, does that explain it to you?
Well, no, but that boy, hold up now. But and Andrea, you said she called about eight times.
Mm-hmm.
Eight times or a month. So I'm just saying, and the hospital's familiar with her, and I don't know. I would have. It's that. If you go underline with that, it was more than that. The activity to me, and I work in a hospital myself. I'm just more. And that was been my intuition. It's a little more deeper than I'm going to buy a car or I'm not going to pay a bill, because you have children at the house. And when you have children, that means if you do something, that might come to neglect of those children. And we're talking about 3 babies. Okay, that's all I wanted to say.
So Andrea, let's so great, Brother Brown X, thanks. So let's keep on going with that. So Andrea, what did they do related to the children?
Absolutely. And Dr. Brown, to your point, it doesn't make sense. None of it makes any sense.
Right.
And if she's being released on whatever these protocols are at this hospital at the time, that's what we had to deal with.
Right.
And so as this continued on, and again, if she's saying they allowed her to function as a decision-making adult.
Mm-hmm.
Even to the point where I am physically there, and the police are in her home, and they say, your mom is standing outside. She wants to see you. Can she come in? She tells the police no. Mm-hmm. So the police say, well, she said no. She knows what day it is. She's in her right frame of mind. I cannot let you in the home.
Right.
Now, 30 days prior to her passing, she began, as I described before, that they began to hoard the children.
Right.
So my daughter quit sending the children to school. So this is November 2017.
Mm-hmm.
At this point, I'm trying to get a hold of her because she has locked herself and the children in the home. So now we're getting to the point, are you going to cause harm to yourself or others?
Right. And what
Dr.
did they
V,
and what did they do?
And so, Dr. V, this is what happened. I was out of town, and I called her school, the children's school, and I say, I need somebody on the phone. And I get the assistant principal on the phone with me. And I say, listen, I need you guys to do a wellness check. I can't get the police to go over there and do a wellness check. My daughter's not answering the phone. I said, you see that the children aren't there. So I'm calling everybody I can, Dr. V, to try and intervene on her behalf.
Mm-hmm.
I call the school, and I finally get to the assistant principal. She says, I can't do it. I said, I'll tell you what. She can be mad at me, but I need you to do the wellness check. She says, I can't intervene that way. She says it to me 2 or 3 times. I said, I need you to talk to me as your girlfriend, your sister, and those are your children sitting in there.
Right.
And I need you to send the police immediately.
Mm-hmm.
And she says, I'm on it.
Good.
Had she not sent the police from the school to do a wellness check, we don't know what would have happened.
Right.
Can I sit here and say she would have done something to herself or her children? We don't know, but I know that she was hoarding the children.
Right. And what happened as a result?
Concerned.
What happened as a result of that with the children? Did the children stay in her care, or what happened as a result of that?
So immediately after that, so this full day, me and the principal are going back. The police go over and they knock on the door and they finally set a police. So now the school district is involved.
Right.
They set a police out in front of her home. This would have started about 10 o'clock that morning. It went until probably midnight.
Mm-hmm.
So all day.
All day.
They finally got caseworkers, okay? They finally got a caseworker out there. And the caseworker says, hey, we got to remove the children, but she won't open the door.
Mm-hmm.
I said, okay. And this went on all day. The police knocking on the door, the caseworker knocking on the door. How do we get her to open the door?
Right.
Well, she finally does open the door. She knows that they're going to take the children. She's in and out of the manic all this time.
Right.
And she says, well, the caseworker says, are you here? Is anyone here? My sister wasn't in town. I wasn't in town. And I knew that my grandchildren had to go into foster care.
Mm.
But I will say that was one of the best things that ever happened.
Right.
Out of all of it.
So I just want to because this actually brings up a good point, because what they will sometimes do is take custody of the children, but then the parent still doesn't get help.
The parent still doesn't get help.
The parent still doesn't get help. And I want to just wait. Because I looked this up as you were talking, because I wanted to find out what was going on in Oklahoma. In 2017, Oklahoma had not expanded Medicaid. I don't know if your daughter was. So Medicaid was not expanded, right?
It wasn't expanded.
So that means that she most likely didn't actually meet the criteria for those expanded services under Medicaid. If she was owned her own business, then it'd be whatever health insurance she could actually purchase on the free market. When you actually go to states such as Oklahoma, Texas is also another one. I had a family member impacted in Texas. They can buy medical care where it is, they call it critical care only. Like it only covers medical hospitalizations. You can buy very, very cheap insurance, and some people buy it because that's, and it doesn't cover mental health. When you expand under Obamacare, you actually then get all access to all of these services. And this is a really important discussion for what we have going on now, where we're actually trying to take people off of Medicaid and what can happen with their services. So I just wanted to I did look that up while you were talking. So tell us, so after they took the children, she was still calling out for help and didn't get it?
She's still calling out for help. And so as I'm telling this story and we're going through what happened in this time, we don't know this, Dr. V.
Right.
The average person doesn't know that.
This is why I do the show.
Yes.
Yeah.
So I am grateful for the insight, but this average person, our neighbors, you, us, we don't know that this is available or what's not available.
Right.
All we know is we're in a crisis.
Correct.
That's what we know.
Correct.
And I need some help. And I need you to tell me what I'm supposed to do. Lead me where I need to go get some help.
Right.
And you got a person who is crying out for help, and you can't help me.
Right.
And so they take the children. And and so grateful they were able to keep the children together. They found a beautiful home, a lovely family that took the children, and guess what? They left her in the house. And so I believe probably 2 days later, she calls again, and they finally keep her in the hospital. They finally admit her. Okay. So they admit her. And at this point, we are now a week before Thanksgiving, right? And so they kept her for, I want to say just a few days.
Okay. In an inpatient psychiatric center or in the
inpatient
psychiatric?
In an inpatient psychiatric center.
Gotcha.
All right. And so now they let her out. So to the caller's question, they did eventually feel as though her life would be in harm, or otherwise the children have been removed, but they allowed her to be admitted. Right. And so in that, she gets out, and I'll tell you what, within 30 days, my daughter was gone. She was heartbroken. And we talked about, whether it was suicide or not. I tell people God put her to sleep. And she was heartbroken. She was heartbroken that whatever's happening with me, Mama, why didn't you get me some more help when I was younger? Didn't you see this going on with me when I was younger? She asked me this question. And again, I'm asking your listeners to listen. Right. Don't blow it off that, he's just crazy. They're not crazy.
So let me ask you this. What did you see when she was younger?
When she was younger, and I tell people this, in my work, what happened to your child at 3, 5, 7, and 9? There's traumas that happen. There's breaches that happen, Dr. V. And at around 5, Courtney was showing just this uncooperative side, that bad kid. Ooh, she bad. Ooh, okay. I'm not watching her, right?
Right. Was she diagnosed with anything?
She was diagnosed with oppositional defiant disorder.
Okay.
All right. As a parent, you're like, well, what is that? I know what ADD is, and I know what ADHD is. And they're like, okay, well, she doesn't fit the boxes for this. So what boxes she does fit is this.
Right. So let me just because a lot of our listeners may not actually know what oppositional defiant disorder is, and so let me just kind of go through that. And it's interesting that you use the word 5 years old, because 5 years old is actually the time period where most kids get diagnosed with oppositional defiant disorder. Yeah. And it is an extreme rejection, argumentative of authority. So these kids, they'll lose control of their temper. They're easily annoyed. They're often angry and resentful. What's important is they will deliberately annoy or bully or attack other people. They blame others for anything that happens to them. They are extraordinarily vindictive, right? If they're less than 5 years old, this happens most of the days over a period of 6 months. If they're over 5 years old, then this may happen sort of once a week, right? And it impairs their ability to even have friends at school. It impairs their ability educationally. It impairs a lot of areas of functioning, right? And what happens is the severity is diagnosed based upon how many settings does it occur in. Does this occur only at school? Does this occur at school and at home? Does this occur at 3 or more settings where this child is like this in almost any setting? So that's the diagnosis, and that's some of the criteria. 5 years old is a very pivotal age. So tell me what you were seeing with her, and I know we're kind of coming to the top of the hour, but tell me quickly what you were seeing with your daughter at 5 years old.
I'm seeing if I don't get my way, we call it a tantrum. If I don't get my way, then I'm just going to fall down and just throw myself into a wall, or I'm going to scream at the top of my lungs.
Right.
And I'll never forget where I knew that something's going on. Not only did you not just do it with me, and as parents, we have to watch this behavior. Do they do it with others?
Right.
To your point, they're like, okay, well, they don't discriminate. You know, she got an attitude with everybody. That's what we call it, right? She got an attitude with everybody. But she's 5. How she got an attitude with everybody?
Right.
But now, mind you, she was a sweet girl. Now, don't get me wrong. She's a lovely girl. But when she was at school, and that teacher is saying, hey, I can't do nothing with her. You got to come get her. You got to come get her. She can't stay here. She just threw herself down the stairs.
Right.
She just threw herself down a flight of stairs.
Right. They will usually act out to the point of causing harm to themselves, whether or not they bang their head in the wall, or throw themselves down the stairs, or hit a wall and sometimes they hit a wall and they'll literally break their metacarpals, the hands and their bones, from breaking a wall. So it's a very extreme. So I don't want anybody to think that this is just a bad child. This is an extreme.
There is something going on, and it doesn't happen all the time.
Right.
And again, I just encourage your listeners to not put their head in the sand and say that, oh, there's nothing wrong. Oh, they'll grow out of it. And you may have brilliant children, smart children, creative children.
Absolutely.
Number one, we can't treat them all the same, right?
Right.
They're all unique in their own special way. But I just encourage our listeners that when you see it, you know what they say at the airport, right? When you see something, say something.
Yes.
Right?
Yes.
I just encourage yourself to seek understanding what's happening with your child.
Right.
Because oftentimes there's evidence there. For my daughter, even though she would have grown out of that behavior, now I'm going into junior high. Now I'm dealing with, adolescence. It changed into something else. She was a beauty queen. She was a typical teenager.
Right.
But it shifted, okay?
Now in it when she was younger, from 5 years old to going into high school, was there any interface with the mental health community or treatment or medications or anything, or you kind of just struggled through it?
Well, you know what? I learned how to manage her personality.
Okay.
And so during that time, Dr. V, there wasn't a medication to put her on.
Correct. A lot of people don't. Okay, so wait a second. A lot of people don't realize oppositional defiant disorder. There is no medication. I'm glad to bring. I'm glad you brought that up. It does require a lot of cognitive behavioral therapy. It can be very, very tough, even to this day.
You got to be willing to put the work in, Dr.
Absolutely.
V. What's interesting with my daughter, with her lovely self, she says, Mama, did you put me on something? I said, well, honey, I didn't. All I could do was what I could do. I tried to give you coping skills. We tried to learn how to deal with the behavior. We worked through how to put some patterns and some habits together.
Right. And I want our listeners to realize that when your daughter died in 2017, how old was she?
She was 26.
Okay, so this was 30 years ago, right? If she was 5 years old, this was 25, 30 years ago. We're getting towards the end of our show. Is there any quick, very, very quick thing you want to actually tell people?
I want to tell people don't fool yourself. And it's okay to be honest with yourself and your family. I want you to, if there's help that needs to be sought after, to seek the help.
All right.
Do not be ashamed. Do not be ashamed.
Awesome. Thank you.
For those who are family members, don't shun them.
Absolutely. Embrace them.
Help out there.
Embrace them.
Absolutely.
Well, folks, that's a wrap. I really appreciate, Andrea, you coming and joining us today.
She blinded me.